Make sure you switch off your phones. I'll be taking through astrology and entomological techniques for today. When is the date today? 27. Okay, because today is our first class, I want us to define what is parasitology. Anybody who can try? Yes.
Parasitology, in my opinion, is the scientific study of parasites.
Good clap for him. And what do we mean by the word techniques?
I would say techniques are basically the methods, the specific methods that we can use in parasitology.
Clap for her. So today we are going to learn. It's a lab session, but I want us to have a clue about the lab session. So we are going to learn about how to collect blood, label, and how to handle. Our sample of today is blood. What is the definition of blood? The definition of blood. When you talk about blood, what comes into your mind? We have several components of blood. We are only going to mention them. One is components of blood. Components of blood. Yes. Platelets. The function. What about the function of platelets? Anybody who can try? Yes. A clap. And a clap for palm. Another component of blood. Yes.
Plasma.
Plasma. Another one.
We have the white blood cells and the red blood cells.
Function.
White blood cells for immunity purposes.
White blood cells for.
Immunity.
Okay, it helps to fight diseases. What about the red blood cells? Transport oxygen from the lungs. Okay. Now we are going to know the materials which we are going to use for the practical session, which is our next class. Now we are going to mention materials. I hope realize you have gloves. Function of gloves is the function of gloves.
It's protect protect the application from coming into contact with the specimen.
Another material is to treat. Another one, lancet. Another one. We have so many. So our sample of today is blood, but we have types of samples which is urine, blood, stools, tissue, and sputum. Where do we collect blood? When we want to test malaria, where do we collect blood? Pardon? Okay, we collect in the hospital, but specific part of our body, or maybe
We collect from the index finger.
another child. Hello? Yes, try. Okay, blood collection. We collect from capillary blood and venous. This is through the vein and this one is through the capillary. Now for the plasmodium, the first part to collect blood is through the capillary. We can perform a venipuncture here, or maybe remove it in the vein, whichever. Okay, come on. Okay, before we go to the procedure, I want us to brainstorm our mind. You can think and pair function of blood. Think and pair function of blood. I'm going to give you 2 minutes for that. 2 minutes, think and share with your peers.
nutrients that nourish the body.
Okay, good. Now we are going to the procedure of how we are going to collect that sample. One is select and puncture the side. The second one, clean the side with alcohol swallow. Why do we clean? When you want to collect the blood sample, why do we clean?
You want to make sure that the site is sterile and the results that you are getting from the blood is from the blood and not from the site.
Good. The next one, we wipe away the first drop of blood. Another one, we allow new, after we wipe, then you allow new drop of blood to form. Collect the blood on the slide. Slide gently to the drop to make thick and thin. Apply gentle pressure with cotton wool to stop bleeding. Why do we apply gentle pressure?
To allow blood to occur.
No. Why do we apply gentle pressure and cotton? Why do we apply gentle pressure with cotton wool to stop the bleeding? Repeat.
So it is basically to stop the bleeding.
Okay. Then you label the slide. Why do you label the slide? To identify the speed. And how do we label the slide? Which criteria do we use?
You use the image.
Age. But you see, age is very wide because in a hospital session, when you say like maybe your child is 1 year, you see that one is very wide. You cannot label those tests with age. Another try.
Maybe the name of the person who acquired the specimen.
Man. Okay. Good try. Good try.
In hospitals, there's a special code to keep a patient. So you can use that patient's code to label the sample. In the hospital,
Yes.
they usually give patients a specific code number. So you can use that number to trace that sample to a specific patient.
Okay, we use barcodes, which the computer generates. We use barcodes to avoid the confusion. Okay, our next lesson will be doing practical, and the assignment for today, you go and draw and label all the blood components. You can write it down. Draw and label all the blood components. Thank you for your cooperation. Have a nice evening.